on managing low back disc. I have to be completely honest with you. I was a chiropractor dealing with disc herniation in my back over the last month or so, and it's taken me away from golf. Luckily, I have all the resources here to manage it, and within about 2 weeks, I was able to reduce the sciatica I was having. I was really having tons of pain right down into here. It really started down here. A lot of pain, no numbness, tingling, no weakness, but just sharp shooting pain, that burning type sensation. And it started kind of coming from here. And lucky enough, Dr. Wassman was able to diagnose it through some mechanical testing and really essentially realized I had a disc that was probably a paracentral left herniation, where it was just coming, out to the left a little bit, irritating the nerves. And so from there we did, certain chiropractic treatments as far as adjustments. We did some traction, and then from there I was doing a lot of McKenzie exercises, which I'm going to show you the 2 things that I needed to particularly do to get rid of it, and I was really diligent about that. And I would say after about 2 or 3 weeks I started getting rid of the leg pain. So the first thing that we want to do is get that leg pain to disappear. And then what I've been probably dealing with for the last week now is just some low back stiffness. So I'm not ready to get back into golf just yet, but I'm close, and I got to work on some of the rehab exercises I've been doing. But for me to try to get that disc to essentially get off the nerve was these 2 mechanical exercises that I did. One was I wanted to get extension. So when you have a disc herniation, extension a lot of times is going to be beneficial for you. And so what I was doing was a prone press up, to where I just would get onto the ground. You first would want to start here, and then you can see how you can do as far as a full press up. And I was doing, about 8 to 10 of those, and probably two to 3 times per day. And so that was number 1. The second one I was doing, so if I went like that, I was okay, but when I went into there, that's where where I needed to really get that motion going. And so what we did was, you could use a wall or anything. I was doing a side one, right? So that's the way I didn't want to go. That would cause me some issues. And then here is the direction where I needed to get improvement from. And so I started doing these as well. And that really helped managing the disc symptoms. Because a lot of people think once they have a disc herniation, they have to go get surgery, they have to get an MRI right away. Sometimes there are certain red flags we look for, and if you're dealing with these types of symptoms, you always want to check with a physician on as far as what you need to do. And luckily with me, I did that and realized by doing those particular exercises and the chiropractic treatment here, I would be able to resolve my symptoms without having to get it surgically removed or anything like that. So I did those 2 exercises. Now I'm up to core stability exercises and really strengthening the abdominal region and doing all of that. And I'm doing a lot better. And I didn't have to go and get an MRI, I didn't have to go and get surgery. Again, I didn't have any certain red flags that would really want me to run out and see a surgeon. So managed it here and doing a lot better. So if you're dealing with those types of symptoms, always get it checked out, because even though I did those 2 particular exercises for myself, they may be different for you depending on what's going on. So always check with a physician, but understand that if you are dealing with disc-related symptoms, you can manage it conservatively and get rid of it. So that's it for today's episode. Have a great week, and we hope to see you again next week.